Hi everyone, I'm Maude Champagne. I'm a psychotherapist in the field of complex trauma and fetal alcohol spectrum disorder. I wanted to tell you today about a common issue that we see with children and youth who display aggressive behaviors is something called mentalization. So mentalization is our ability to understand someone else's behavior and basically reason behind their behaviors. So, for example, if someone gives me a gift, I might think, oh, wow, they're giving me a gift. They appreciate my work, they appreciate what I do, so they just want to thank me. But for someone who's been traumatized, who have complex trauma, or even for their neurodivergent, they might think that you are giving a gift out of manipulation. And we're seeing that as well when we're setting boundaries as parents and our child is as either attachment issues, trauma, or fetal alcohol spectrum disorder. They may experience those limit settings, boundaries um, as us being non-caring, not understanding. So what happens is sometimes there's uh, occasions where there's strangulation. So the child is upset. They may talk to a worker, someone at school, a relative, and they explain their perspective that is not necessarily fully accurate, but it's more like based on their difficulty with mentalization and understanding their parents' behaviors and understanding their perspective. So it's really important to, of course, validate their experience and their feeling, but also to challenge some of the things they may um, think. So, just saying things like, I wonder if your parent was really concerned when this and that happened or when you made those choices. So, doing that in a caring way, but also in a way that is supporting the parents in their while they're trying to set boundaries and make sure they have a safe environment for their young person. In nonviolent resistance, which is the approach we often use, we try to have a common narrative about the child. We keep the line of communication between school, relatives, supporters in the community, the parents, um, a line of communication that is quite open. So if there's a disclosure, there's a concern, then we can talk to each other and figure out how we can best support the young person, but also support the family members because they also need to be safe. And in the majority of cases, parents, all they're asking for is that they have a safe environment for themselves, for the siblings, and for the young person who's maybe struggling with aggressive behaviors and emotional regulation issues. So again, that comes down to mentalization and how we can support a young person to develop better skills around mentalization is also by challenging some of their perspective and helping them figure out how we assess someone's behavior, and just kind of explore, being curious with them about what that could mean. I really encourage you to keep supporting our young people who are maybe experiencing AFCCA, support their families. We want to keep our community safe, our families safe.